So it's called Cavilon. And that was originally created for the reducing the rashes at newborns in the diapers area,
Yeah.
But nowadays they use it mainly for people who have a stoma, I think it's called in English. This artificial intestine exit, how you call it.
Yeah,
Stoma.
I understand. Yeah.
So where you always have to put in a new bag, and some people react allergic to the acrylic. So that one protects the skin quite well. It doesn't go away totally, but it reduces. So if somebody is allergic to the adhesive, it can also help to put on this spray.
Okay.
Before you put the electrodes.
Yeah. So you would spray first, let it dry a bit,
Yes.
and then put the electrode on. Yeah.
Right.
Yeah. No, that's interesting, because many of our measurement also with the accelerometers, you attach it usually on the thigh.
Yeah.
And some people react. So maybe this spray would be a good solution for them. Good. What else? What kind of things you use in your electrodes? Do you have offset connectors, breathable packings? Yeah, tell a little bit more about the details.
Oh yeah, we focus on the offset connectors.
Yeah.
And offset connectors are extremely important when it's about long-term measurement and cables.
Yeah.
So because they give a certain flexibility. So when the cable is pulling, it's not just pulling directly on the core, but it's pulling on the side, and then the side kind of releases or reduces the pulling. And what else we have? On the other hand, it's foil-based, the electrodes, so it's standard foils, which are used either in the food industry, because of the biocompatibility, or in the textile industry.
Yeah.
Obviously, that's an important factor regarding biocompatibility. We also focus very strongly on the biocompatibility aspect and the sustainability. Biocompatibility is a must. Obviously, it's medical, but then sustainability, because most electrodes, the problem is you open the aluminum package, they come in aluminum packages, to reduce that they dry out, obviously. And then once the aluminum package is open, you have to use them within 7 days. If not, the signal quality will be reduced. Most people, and I mean, it depends on the hospital and the service provider, but there are a lot of service providers who don't do so many Holter ECGs or ECGs, and then they have to throw them away. And one big advantage on these electrodes is there's this humidification system inside. You pop it, and then it's fresh, the signal. But if you don't pop it, you still can keep it 2 years. So this is another aspect which we have been focusing on quite strongly, the idea of sustainability in terms of disposables, to reduce the amount of waste in that area.
Yeah. Sounds good. And maybe question like for example, we have this our flash device, and you can attach 2 electrodes to it, and basically you could have like an electrode here, but if you think that I do something on my chest, my skin is getting stretched, or if I slouch, it's getting shorter. So is it good to have them like that the device is between the 2 electrodes, or should it be like kind of L shape, or do you have any recommendations?
So,
like what makes it the best that you would get the least amount of movement artifacts or pulling there?
So we developed an electrode for the motion sensor, and currently we are redesigning it from the material perspective, because as we've seen, here is foil-based, here we still had an injection mold part. And so one important factor, if you use a device like a motion sensor and you attach it in the middle, in that case, it holds quite well, because the whole adhesive is around and the electrode is well attached to the adhesive. But if you, for example, use a connector, then it makes sense to additionally tape the device to the skin. So then you automatically reduce the pulling on the electrode. And that, on the one hand, it makes that the adhesive still stays strong. On the other hand, it reduces that the core is like moved and shaked. So you still have a stable signal quality. So I think one of a very important factor is But beside the electrodes, it's to, if you really want a good signal quality, to have a tape at the cables or the device.
Yeah, and leave some loose part kind of between the electrode,
Right.
that it's not too tight. Yeah.
Right.
I've been in my previous job. I was product manager for EMG devices, and we had the 16-channel device and 3 electrodes per channel.
Nice.
So I was sometimes wearing 48 AMBU electrodes on my body and
Oh,
16
wow.
cables. So I've been testing them, and
Yeah.
it's a lot of cables. You were like full of electrodes and cables. Yeah, very, very interesting. So many things to consider when you want to get long measurement and good data quality. And what else? Is there anything else you would like to tell about electrodes and signal quality?
So, generally speaking, the cheap electrodes are not good for long term.
Yeah.
We do have a lot of medical device manufacturers who ask us for distributing these electrodes, because a lot of customers which are using their devices would later call the device manufacturer and say like, hey, your device doesn't provide good signal quality. In that case, it's not the device. The problem is the electrodes, because they use the cheapest of the cheapest, and then they realize after one day the signal quality is not as the beginning of the first 2 or 5 minutes. And so, yeah, use good electrodes. What else? Obviously, you can try ours out under nahtlos.com. You find there are products. You can also send me an email if you have specific questions or if you want to try them out. And then, like some other factors it depends on how long you want to measure. But if it's longer than 3 days, I would really consider also the patient comfort, that you don't have to tell the patients to exchange the electrodes every day or every 2 days or 3 days, but they maybe have an electrode which they keep 7 days or 10 days on the skin, and they can shower with them, and they cannot basically put it on and forget about it.
Yeah. And I think from the physiology point of view, if you, for example, measuring heart rate variability, it's usually really beneficial to measure it for longer times. If you're looking for stress, for example, the
Yes, definitely.
different days
Yes.
are so
Yes.
different that if you actually want kind of scientific differences, you might need
Yes.
much longer duration that you actually can detect and kind of normalize for the daily stresses or something. So it's very useful to have long-term measurements, and also for if you, for example, want to use machine learning and want to find new things and train models, it helps when you have a longer data. And maybe just as a few ideas, like have this device, for example, that you can wear it on the thigh, and then you can detect when the person is sitting, standing, walking. You could wear a device which is measuring heart rate variability at the same
Yeah.
time, and then you would have actually annotated data that, all right, now the person is laying down, now it's sitting.
Nice.
And you could
Yeah.
start training, for example, with machine learning, different models that would see how the heart rate variability, how the ECG changes when the person changes posture, because it affects the blood pressure, it affects many things. So I think there's a lot of opportunities when we can just comfortably measure longer durations, and it comes to electrodes, it comes to the signal quality, comfort, and also the devices that they are easy
Yeah.
to operate for long durations. This has been very, very interesting discussion, Jose. Is there anything you would like to add to the discussion?
No, I've never been asked so many questions about electrodes. I'm quite glad that somebody saw this topic of electrodes, because mostly it's neglected. And thank you so much. And if you want to try our electrodes, obviously, just shoot me an email, go to our website. And yeah, I'm happy to see what kind of people react to a video about the electrodes.
Yeah. So I will put Jose's email in the episode description and also the link to Nahtlos website, so you can find them there. And I would assume you would be interested collaborating with researchers if they are interested doing studies examining, for example, the signal quality in HRV measurements or so on.
Yes, definitely. And beside HRV and ECG, that is our main focus. But we did, for example, underwear for long-term electrostimulation for people with quadriplegic or tetraplegic. And or we also had an EMG case for pelvic floor training over a long term. So we are quite open also for other ideas. It doesn't have to be only a long-term ECG.
Yeah, and actually, I mentioned about my PhD, I did a long-term EMG measurement with textile electrodes, and it's not done much. It's interesting because when you study, for example, sedentary behavior, people often study the posture, like whether the person is sitting or standing, but what physiologically is physical activity is actually the muscle activation. And it hasn't been studied much, mainly because it's a bit challenging to measure long durations of EMG. How do you see, is there any different requirements for EMG measurements than ECG? Many times when I was product manager, we used AMBU electrodes or recommended them. Do you see any differences for EMG then?
Yes, the frequency is different. The frequency you have to measure. So mostly EMG overrides ECG. So it's easier actually to gather the signal. But the frequency range, I cannot tell you right now. That would be my co-founder, who is the technical expert in that. Well, we, for example, also use the MoveSense sensor in order to build an EMG device. Because the EMG would override the ECG, and then we would have both the ECG and the EMG. In that case.
Yeah. Interesting. Yeah, let's finish up here. So if anyone is interested in collaboration or testing Nahtlos electrodes, check the website or send an email to José. Thank you, José. This was a pleasure.
Thank you, Oli. A pleasure too.